Hello, friends. So first of all, I want to thank the organizer for giving me this unique opportunity to discuss about this important topic on breaking bad news to your patient. So for next maybe 20 minutes, we will learn about few important steps on breaking bad news. So at the onset, I want to thank my professor, my teacher, Dr. Ardhendu Sinha Roy sir, because during my undergraduate days, I had learned a lot how to deal with this issue, and his simple conversation, the communication skills had amazed us and helped us to learn a lot. And also, I want to thank Professor Shantanu Kumar Tripathi, Padma Shri Dr. Shashank Joshi sir, Professor Jyotirmoy Pal, and Professor Nandini Chatterjee madam, how to become an effective communicator is extremely crucial for being a doctor. And when we are talking about breaking bad news, that is also important issue. And I had learned a lot from them. And finally, I want to acknowledge Dr. Shoibal Moitro sir, who had also given me practical experience when talking with patients, relatives, and breaking the bad news. So with that, let's start our journey today with a sad news of a 41-year-old male who presented with HSCT thorax, and there was a mass lesion. So when we talk about this breaking bad news, first of all, we need to understand about the effective communication and how we can prepare ourselves. And then, most importantly, how to set the stage and how we should assess the patient's current level of understanding. Then, obviously, how to deliver the news, how to respond to different varieties of emotional reactions from the patient, how to provide further informations and different options for therapeutic strategies. We need to address our patients' questions, their concerns, and we need to have a collaborative care plan. And that is also important, how to maintain that interdisciplinary approach. And it is most important to provide emotional support. And what should be the follow-up, how we can continue the communication. Because there should be some different treatment strategies for each bad news, but we need to communicate that effectively to the patient so that there should not be any loss to follow up. So first, when we talk about breaking bad news, Bailey et al. Proposed this mnemonic, that is spikes. So if we follow these spikes, then I think that is very easy to communicate the bad news to the patient. So when S starts with setting up the interview, every points on those setting up the stage where we are communicating is extremely important. Then perception, patient's perception, need to assess that. What is the perception, current level of understanding from the patient side? Then I means invite. So invite patients' queries. So after obtaining the patient's invitation, then only you have to give the knowledge and information to the patient. So we need to wait for until the patient invite us. Then the E is important here when we are talking about any bad news communication, and that E is emotion and empathic response. So we need to address the patient's emotions with empathic responses. And finally, we should have a proper strategy and a plan, what we should do in the follow-up, and that should be summarized to the patient and patient's relatives. So that is also important. So the spikes protocol is always help us while breaking the bad news. So as we all know, what is bad news? Any news that drastically and negatively alters the patient's view of her or his future. So that is bad news. And that is why we need to be extra careful dealing with this bad news delivery. We all know this delivering bad news is the one of the most daunting task, because from our early days in our MBBS training, the curriculum, there is less stress on these communication skills, and we always have a tendency to give more value towards the technical proficiencies. So it is important now, and the current medical education system is also giving stress on how to improve these communication skills. And I think I should thank the organizer, because they are providing us this type of topics nowadays. So we need to give more value towards the communication skills now. And there should be a proper balanced training during our curriculum with technical proficiency and communication skills. There is some perspective from the doctor's angle, because there could be a fears of blaming, some reactions from the patient. We can be emotional and some uncertain responses. And that also may be responsible for some emotional disengagement. So when maybe I am delivering a news towards my patient's relative that yes, your father is suffering from end-stage kidney disease, and along with the cirrhosis of liver, there is hepatic encephalopathy. So we should count the number of days. So at the same time, I may remind my beloved grandfather, when he was dying, the same situation happened. And that may lead to some emotional disengagement. So we need to be taking care of those issues. So why we should take care on that issue? Because that will lead to inadequate delivery of bad news, which may impair long-term patient and relative adjustment too. And we should deliver this type of news with highest level of sensitivity and adequacy. So when we talk about effective communication, that is the key to successful delivery of bad news. Because if you are delivering bad news poorly, that leads to some negative outcomes. That is why we need more training. Ourselves should be trained more on that particular aspect of delivering bad news. And this effective communication skill should have a patient-centered approach. And we need to include the family. Because if we include the family And this embracing patient-centered approach can have a high level of patient satisfaction. There are multiple studies done which had suggest this. And if we have a perfect, effective communication that is perceived as emotional, available, something available for me in future, that means even I am suffering from some end stage disease, there could be some chances. So that availability, hopefulness, that all should associated with this effective communication. So this we need to remember. So when we are talking about breaking bad news, we need to acknowledge few important issues associated with doctor-patient relationship. Here, we need to acknowledge the disbalance between physician's authority versus patient's choice. We need to be very cautious because in general, the paternalism is the most important or most prominent thing we encounter in our daily practice. And that includes the absolute physician's authority. And sometimes it is important to note that our patient also think like that. They will tell, डॉक्टर साहब आप सब कुछ है, आप भगवान हैं, आप जो करना चाहते हैं करिए, मैं ये कुछ नहीं समझता. So that is actually the absolute physician authority. But modern science, modern day effective communication skill give emphasis on patient choice and patient autonomy. So we all know that triad of evidence-based medicine, where there is 3 arm is present. The number 1 arm, which give emphasis on available scientific evidence. Number 2 arm gives importance on physician's expertise. But number 3 arm is also important, and that is the patient's choice. So we need to have a proper balance between this patient autonomy and paternalism. And when we are evaluating, we are going through the evolution of this doctor-patient relationship, we need to move forward from that paternalistic model to patient-centered model. So what is paternalistic model? There, doctor acts as guardian, and there is obvious limitation in patient autonomy. So this model does not fulfill the need of modern times. There is another model, that is informative model, where doctor provides all relative information and patient has total autonomy in making the decision. So that is something informative model. So here doctor is providing some facts to the patient. Then it comes the interpretive model. So here not only doctor is providing some information, but also doctor understands the patient values. They may help in selecting appropriate intervention. So that is interpretive model. So doctor here helps the patient to find their preferences. But now the model is deliberative model, where doctor provides information. They also understand the values of the patient, but they also involved in a collaborative decision-making process with patient. So that is the deliberative model and most preferred model nowadays. So the doctor here, in addition, telling his preference to. So not only the doctor helps patient to find their preference, but also doctor in addition will tell, this is my choice. This is going to give you benefits in terms of some outcomes. So that is important. So factors to consider when we are delivering the bad news, the most importantly, as we had mentioned, the physical setting is important. It should be quiet, comfortable, and that should be a private location. So convenient time, no interruptions, because this type of delivering requires ample time for the conversation. And always important, in-person delivery preferred. As I had talked about Professor Ardhendu Sinha, my professor, he used to come to the patient's family each time when delivering some bad news. We were intern, we were house staff, we were junior residents. So we were there to witness how he is delivering the bad news. So that is most important. The in-person delivery is obviously preferred. Offer choice to be accompanied by someone from their support network, because sometimes when we are delivering some bad news to patient, we need to ask them when they need someone else from their supportive group, maybe friends, maybe some family members. So we need to ask that. And the message, what I am going to forward, I am going to tell, that should be a properly prepared one and informed every aspect. Before delivering the message, we need to assess the patient's existing knowledge, and then we need to deliver the message. Always need to convey hope and optimism, but it is also important to address, we should not deliver some news which can cause some false hope. So that is also important. And obviously, we need to allow our patient for their emotional expressions and questions too. Finally, need to summarize the discussion, and always it is important to deliver message with empathy and respect. We should not use any tough language, technical language. It is always important to use understandable language. Always need to avoid different medical jargons here. So, another important model for delivering bad news is ABCDE, which was proposed by Rebo and McPhee et al. So A means advanced preparation, B means building a therapeutic environment and relationship. So this is also a doctor-patient relationship, and that model is therapeutic relationship. Communicate well, deal with patient and family reactions. And finally, we need to encourage and validate those emotions. So how we can prepare ourselves? So first of all, we need to familiarize with all clinical information. So we should have go through properly with that patient's charts, what are the relevant data available, and we should also have a background study too. Before I am going to deliver some news which is going to impact my patient's future life. Basic prognosis and treatment information, we should be thorough on that. It is always important to understand a beautiful sloka here. Atmana pratikulani pareshuna samacharit. That means We should behave with others like that. In the same way, we expect others to behave with you. So it is important to consider how you should prepare to deliver this type of news to others. So you should do that in a same way that you expect someone to deliver the same news, how they should behave. So we should be very careful. Arrange for adequate time and privacy. So sometimes while delivering this type of news, we have some phone calls. We will take that phone call. We'll talk some other things. That is totally discouraged. We should not have any interruptions while delivering the bad news. We need to switch off our mobile, and that location should be a private one, comfortable one for me, for my patient, for my patient's family. And there should not be any interruptions from the staff or any other devices, as already discussed. And rehearsal is important. We often miss that because we should have a good practice on how we are delivering this news. We can practice it. And we may use or may not use some scripted specific words or phrases. That depends on us. But sometimes, again, same word is not valid for all patients. So here also, we need to individualize. The personalized delivery of bad news is important. Observe experienced colleagues or may rehearse some role play, emotional preparation, because at the same time, we need to manage our own emotions. And there also, we may need to take support from colleagues or mentors, and always establish the empathy and a proper rapport. And for that, it is important to create this whole supportive environment. Now coming to B, that is a building a therapeutic environment or relationship. So here we need to determine the patient's information preferences. We need to know, we need to understand what and how much they want to know. Whether they require some supportive persons, and that is totally at patient's discretion. So family presence and involvement. Finally, we need to introduce ourselves to everyone present. Some family members may not know me, so we need to introduce. Ask for names and relationships to the patient when we are talking with our family members. And foreshadowing the bad news, we should start with like that. I am sorry, but I have to tell you this. It should be correct. We should follow this professionalism and sensitivity issues. We may use touch, but that touch should be appropriate one. And here we need to consider some cultural differences too. So we can use this touch, but that touch should be appropriate one. We should avoid any inappropriate humor or flippant comments. We need to assure patient of your availability, because this is the time we need to tell our patient's relative that I will be there for you for your continuity of care. So we need to ensure seamless continuity of care. We need to provide some contact information for urgent needs. So that is also important here. Encourage patient to reach out for any concerns. So ask the patient relative to address some important questions to you, and you should answer those questions. And important to be prepared to address follow-up questions. So first of all, when we are communicating, we need to assess the prior knowledge, ask what patient or family already knows about that particular disease. We need to understand their expectations, and all this communication should accompany with a frankness with compassion. We need to speak openly. Yes, we need to avoid the euphemisms and plan language. Our language plan should be very critical here. We should not use any jargons. Simple, plain language we should use, like cancer, death. We need to be very clear, open. We need to allow silence and tears. This is important. To respect patient's emotion and pace, we should not rush to fill this silence. Have patient explain their understanding. Then in that part, we need to encourage questions and clarifications. Enhance retention and comprehension. How to enhance that? Write down the key informations. We may use some visual aids. We can draw some pictures, sketches to make them understand. Sometimes we need to repeat and reinforce the important details. And finally, summarizing and planning for the follow-up. Again, here we need to recap the key points discussed. We need to ensure the clarity and understanding, and finally need to discuss next steps or future appointments. What are the different important points regarding the coordinates that required for necessary arrangements. Dealing with patient and family reactions. So that is again important part, the D. We need to identify and acknowledge patient's emotions, be aware of cognitive coping strategies. We need to track emotional well-being over subsequent visits, and any signs of despondency or suicidal ideations we need to catch and properly address. Always show empathy and honesty. Here, when we talk about this empathy, the word empathy that starts with E, one important organ, or we can say one of the most important organ for effective communication is your eye. So your eye should be properly placed over patient's eye or patient's family's member's eye, because that is the organ which is going to show empathy to the patient and your patient's family. So for empathy, you need to take care of your eyes. Do not communicate your patient. You may telling some very good words, but at the same time you are seeing some WhatsApp message or Facebook comments like that. Do not do that. We should not do that. So show empathy and honesty. It is appropriate to say, I am sorry if I do not know anything. So clearly mention, honestly mention, I don't know. There is no harm in that. Reflect on personal reactions. So we need to examine the personal tears and their sources. So sometimes we may have some tears while delivering this type of bad news. But yes, it could be. There is no problem in that. But one thing we need to remember, if the source of my tears is due to some other personal causes. So that means I am disengaged to this particular patient. So my decision making may be compromised. So need to take care of that issues. Sometimes tears may come, and you may allow to have that tears, but we should also understand the source of the tears. If it is something else, it is due to my personal reason, other causes, we should disengage by ourselves and let other colleague to proceed for the proceedings, or we need to take care of ourselves. We may rest. We can have a one glass water. We can drink one glass water, little bit relax, then talk with the patient. So that is important, because no personal reactions should disturb this communication. We need to differentiate empathy from personal issues. So that is what we were mentioning. We should maintain the professionalism, and most importantly, we should avoid arguing or criticizing colleagues. We should not make some comments like that. You should come to me 3 months back. I can save you, but now I cannot. This is not helpful at all. This is going to ruin the patient. This is going to ruin the patient's family. We should avoid that. And always important to avoid any defensiveness regarding me, my colleagues, or medical care. If the patient is telling me, do not argue, just listen to him, and you may explain empathetically that, okay, so you were thinking like this, but actually this is not, because the science is telling like this. So this is important. Finally, we need to encourage and validate our emotions. Provide realistic hope. Discuss available treatment options. Explore patient's emotional and spiritual need. That is important. And we should utilize different interdisciplinary services, the hospice care, and how to improve the patient care by using those type of services. We may require our psychology colleagues' help too. But it is again important. We think now this patient, I'm not going to help him more, so let me disengage from them. It is not good. Your communication should not reflect that you are going to disengage from this relationship. So avoid using them to disengage from the relationship. Just referring to the hospice care and you were telling you were coming out from his care, that is not going to be helpful for that particular situation. So attend to personal needs is important, because sometimes, as already we had mentioned, we become emotional. So we need to take care of ourselves during and after delivering any such bad news. Address counter-transference issues. Debriefing and support should be properly done, and we should have a proper debriefing session summarizing them, and the involved personnel should be asked whether they have any more questions. And finally, reviewing the medical management and address their feeling. So what are the important take-home messages here? As we had mentioned, when we are communicating, the empathy is very crucial. So our communication skill should be blended with this empathy. And as already mentioned, we need to take care of another E, that is our eyes, when we are communicating. Tailor delivery to patient's needs. So every patient is different. Even our communication skill should be a personalized one. Individualization is required here. We should offer realistic hope and support, and always attend to personal and emotional well-being. Utilize interdisciplinary resources effectively. If you require your psychology colleague, you need to refer them properly. So with that, I want to end here with a case discussion. And this is a real life case. 2 years back, one of my friend had had an experience like this. 18-year male, type 1 diabetic, presented with diabetic ketoacidosis. So SpO2 during admission was 78%, CVG 564. So admitted in CCU, intubated, central line done in emergency. So without any fear, in the emergency department, they had done the central line because the patient's situation was very critical. Now the management also started HRCT thorax done immediately, and it was showing the CORAD score was 4. We all know at that time the COVID-19 RT-PCR reports comes after some days. So it was positive, but report came 3 days after admission. So while communicating this report to the patient's father, now this patient fathers had slapped the treating doctor, blaming his son was not suffering from COVID, but this hospital is responsible for COVID-19 infection. So this is an extreme situation, but it was dealt properly. And what happened? He was discharged. The boy was discharged after 12 days in stable condition. Now the same father who had slapped, now trying to catch the feet of the treating doctor. Now doctor interrupted him and just greeted with a simple namaste. So this is some situation we often face too. So how to deal with that? 4,000, 5,000 years back, our great teacher had taught us a few important mantras, slokas, verses to cope with this type of situation. Dukkheshu vanudvignamana, sukheshu vigata spriha, vitaraga bhaya krodha, stitadhi muni uchvate. That means one whose mind remains undisturbed amidst misery, who does not crave for pleasure, and who is free from attachment, fear, and anger. That is the sage or Muni. So we need to follow these verses. And when we are doing our work, it is important to consider karmannevadhikaraste ma phaleshu kadachana ma karma phal heturubhu ma te shangasta karmani. So we have a right to perform our prescribed duties, but we are not entitled to the fruits of our actions. Never consider ourselves to be the cause of the results of our activities, nor be attached to inaction. So that is the doctor's life. So when we are dealing with our delivering this type of bad news, we are dealing with our patient family, we need to follow Yogastha Kuru Karmani Swangam Tvaktva Dhananjaya Siddha Asiddha Samovhutva Samattang Yogo Uchvade. So be steadfast in the performance of our duty, abandoning attachment to success and failure. Such equanimity is called yoga. So when we talk about delivering bad news, we need to follow these verses. And to the end, therapeutic presence always brings gratification. We need to consider, even we are delivering some bad news, there may be some future hopes too, future treatment strategies too. Our presence should be considered in a therapeutic way. So physician attitude shapes patient coping. Our attitude matters. Everything matters. Even the color of my shirt matters when we are delivering the bad news. And we need proper training, because this training only enhances the delivering bad news. Here, I want to thank one of my colleagues, Dr. Shaugato Sarkar, who had recently write down one very important practical book on pharmacology training, because from our undergraduate days, this type of training was lacking. But now in the book, he had mentioned these different aspects of empathetic communication, because when we are planning for any treatment strategy, the empathy should be there. And I congratulate Dr. Shaugato Sarkar here, because he had perfectly mentioned these issues in his book. Professionalism brings hope and healing. And our role is always important to reach beyond cure. So our role extends beyond the cure. So that we all should remember. Again, I want to thank all my mentors, thank the organizer for giving me this unique opportunity to learn this very interesting topic and present that topic in front of this august audience. Thank you. Thank you once again for giving me this opportunity.